Emergency rooms are facing two major shortages: not enough beds for patients and not enough staff to care for everybody. The ER staff at UPMC spoke candidly about that pressure with our new reporter, Sonica Bargo, who joins us now from the newsroom. Sonica, so good to see you and welcome.
Thank you so much, Alicia. I'm excited to be here. Now, UPMC told me these shortages are caused by more than just the COVID surge, and they mean a longer wait time for patients and a heavier workload for staff. Everyone is feeling that strain.
Tired.
Stressful, very, very exhausting.
That's how healthcare workers at UPMC describe the last 2 years, especially the end of 2021.
The exhaustion from the last 22 months has really catching up with us.
After 6 years in the emergency department, Nurse Miranda Rhodes says the last few months have been some of her hardest.
This isn't what we thought we would be doing when we were in nursing school.
With hospitals facing severe staffing shortages,
It's a struggle.
Rhodes says nurses are taking care of twice as many patients and working up to 60 hours a week.
Not only are you physically exhausted, you're mentally exhausted, and sometimes your heart hurts.
Beds are also in short supply.
Very, very sick patients, we may be treating them in a hallway.
Paramedic Josiah Einwechter says he often starts treating patients in the ambulance. Waiting room times can now take hours not every patient has.
It literally is coming down to, can this person tolerate waiting 4 hours versus this person that can't tolerate waiting more than an hour?
So how can the community help? UPMC is asking people to call their doctor or go to urgent care if they don't have a life-threatening emergency.
Try your over-the-counter, try your basic self-care before immediately calling us.
Einwechter and Rhodes say just be patient. Healthcare workers are doing their best.
Nothing worse than having a really hard day and being physically exhausted already, and then just, maybe not getting the kindest remarks from a patient that you're trying to help.
The systems are full, the providers are exhausted, and a little patience, a little kindness goes a long way.
I also reached out to WellSpan Health, Penn State Health, and Lancaster General Health. All three health systems reported similar challenges, including seeing record numbers of COVID-19 patients. Live in the newsroom, Sonica Bargo, ABC 27 News.
So important we hear these voices. Thank you for bringing them to us. Thanks, Sonica.